Hi, I'm Patty Hayes. I'm Director of Public Health here at Seattle and King County. We're the 9th largest health department in the country for population served, and we're responsible for the health and well-being of the 2.2 million residents here in King County. I see Vroom as such an extremely valuable tool. It allows parents in natural ways to have wonderful brain development moments with their children. And our partners are excited about it because it's visual, it's easy. We've been able to work to get more partners engaged. And that's a key role for public health. That's our job.
So in my work specifically as an anchor partner, I work within these different systems. I build relationship with partners who are based at community-based organizations, medical clinics, libraries, schools, you name it. I'm trying to be there so that I can connect them to this resource so that they have another way to support a child's development while also engaging with their parents and caregivers and families as a whole. And I think that's what's so key, is that people know about the information, but also know that there's somebody back here that they can turn to when they have a question, when they're presented with a challenge, when they see a barrier that they're not really sure about how they can mitigate. They have me to come to and talk to about that, and then we work it out.
So she's been working at the state level as we have engaged the Essentials for Childhood group to be the sort of example of how you can really have an activation point within government that will extend in a widespread. Well, the Essentials for Childhood is a table that seats key state agencies that work with families who really can come together and talk about how do we move policy and system change forward for the benefit of families. I think that opened a door. Devon could then really provide her experience, not only knowing the Vroom system and the Vroom tool, but also how you really work with community. Because at the state level, that's a tough nut to crack. We need folks like Public Health Seattle King County to step up and be that door and that bridge. And I'm very excited about the state really using this as a moment to move it forward. Well, the wonderful thing about Vroom is it doesn't need a huge level of resources to work. It doesn't need a place like King County to be successful. It's all about families. It's a natural all over this country. If you start with the community and they say, well, this is how it works here, and here's our community leaders, then you can walk in and say, well, here's the science, and here's how Vroom works, and it's a natural partnership.